Free to come in. It's fine. I don't mind. So to get started, my name's Liliana Di Miranda, just Lily for short. It's totally fine. I'm presenting at the University of Florida, and then I have some of my coworkers with me. I have Stacy, and then Connor is down here too. And then Luis is in the back. You probably heard me shriek whenever he came in. We haven't seen each other in a long time. Basically today I'm going to be talking to you guys about moulage and how we keep it fun at our center. Moulage can be really intimidating for people, which is kind of what sparked this idea of, as your mannequins are evolving, how do you evolve your moulage with them, and how do you do it at a low cost? I really focus on cost throughout the presentation because a lot of our SIM centers don't have crazy funding, but we want to get there, right? Like, we want to get the funding, and you can use moulage to do that too. And so who we are, we're the University of Florida College of Medicine Center for Experiential Learning and Simulation. That's a mouthful. We usually just say UFCELS. You can find us on Instagram, the internet, everywhere. This is our mission, our vision. Our boss Tom likes to joke that basically it's world domination through simulation. So that's super fun. And we have nothing to disclose today. And so a little bit more about who we are. These are some of my favorite pictures that I took during my time at UFCELS. I was a simulation operations specialist with them for 2 years, and then I just started my journey in medical school in July. So a little bit different, but still super exciting. Thank you. Yeah, I got to skip some lectures to be here today, so I'm super excited. But yeah, these are some cool pictures of what we do, and something I like to point out is we're smiling in all of them, and so are the people around us. And in my opinion, I think a big part of that is the moulage that we do and how we use our simulators, because we want people to have fun while they're training. It's really for them to take something away that's positive and learn from it, right? Oh, and we did go to the helicopter pad in case anyone's curious. Little flex. Okay, so why does moulage matter? You're going to hear me say champions for simulation a lot throughout this talk. Has anyone heard that before? Essentially, a champion for simulation, if you haven't heard what it is somebody that truly believes in this cause. They believe in your center, they believe in the training you're doing, they believe in the product you're putting out, and they truly believe you're helping people. Does everyone here believe that? Awesome, you guys are all champions today. And how we do this is by pushing realism. I like to take a little minute to tell you about Dr. Amali. He's actually one of our neurosurgeons, and I consider him a champion for simulation. Whenever he sees me, I'm setting up LP trainers, I'm not doing makeup, and his residents are in the room. He likes to introduce me as, oh my gosh, here's their makeup girl. That's awesome. I'm actually a simulation specialist, but it's fine. I'll take it. But what you don't see is that the residents all react with a big smile. They're like, makeup, what are you talking about? It gets the conversation going. Of course, I pull up the pictures, as one would, and then now they're interested. Now they want to come back. Now they want to ask other professors, other faculty members to let them in the Sim Center and get them practicing. And so that's the excitement I'm talking about, and it creates facilitator buy-in. I don't know if any of you guys have stumbled upon doctors who are like, I'm not going to waste my time taking my learners to the Sim Center. I'm not going to waste my time. Like, it's not realistic. It's not this. It's not that. It is. You just have to prove to them that their time is valuable, and you know that, and your time is valuable, and they should know that, and your product is valuable, and they'll get to know that. And so the more you buy in, the more growth you'll get. This is my little picture I made. Everyone needs a new simulator every once in a while, but if you don't have it, you can use makeup to achieve that. And then the picture, there's actually some moulage done there, and this is from a tour group where alumni kept repeating, I wish we had this when I was training, because we set up an accident to look like this person's really intubated, they're on a vent, they've got the bruising, they were in a fight at one of the university football games. It's really going downhill for them, but uphill for us. And so the resource on many Sim centers can be tight. I mentioned that when I first started. We don't have endless funding, right? Especially when you don't have these champions at your center yet. And so the more ways that you find to achieve quality at a low cost, the more funding you'll see start to trickle in, right? More people start caring, you start drawing attention from different units, your school starts to take notice, maybe now the deans are touring around, nursing faculty wants to get involved, it's really cool. And so you don't have to be an expert to start. If you're scared, just say you're scared, but do it anyways. And then trial and error is your friend, even if it's controlled. And I'll tell you a little story about why I say that. So there are mistakes, and they can be expensive. Does anyone know like how much a simulator costs? A lot. Too much. Some might say a Tesla. Some might say a semester at med school.
We have a card.
It really is about a semester at med school. But anyways, if you stain these mannequins, obviously you're ruining an expensive product. It's like scraping your brand new BMW, right? You have confused learners. I've heard everything from, Mr. Hank, did you fall today? He didn't. Mr. Hank is a 60-year-old waiting for you to stop talking so he can code. All right, so you don't want to do that. You don't want to confuse your learners, and you don't want to waste your materials. You spent all this time sourcing them, buying them, finding them however you could. Don't waste them. Don't make silly mistakes. And so this is what we found that doesn't work, and these pictures are very basic, but we had things like dyes, food coloring, grease paints, creams, blue eyeshadows, watercolors, all things you would see in like an art kit, right, or a moulage kit. And right now you're probably thinking this girl's favorite color is blue. It's not. My second week working at the university sim center, I literally stained this entire mannequin. I was 22 at the time. I had just graduated college and I had about $0 to my name. And so naturally, I hid in the control room and I cried. And then I started looking up how to take out a giant loan because Tom is definitely gonna fire me and I can't pay him back for this. And so I was freaking out, and does anyone recognize this mannequin? Yeah, Simon 3G. He had a rough day at our sim center. This was actually for a trauma session we were doing, and it called for all this bruising, and I thought, you know, I've seen the warning signs on the grease paint that say don't leave it on a mannequin overnight, don't do it the day before, so I didn't use them. I actually used a bruising wheel that was in the moulage kit, and then some hours later, that was the result. And in case you're wondering why I was crying, or if that's dramatic, I really had no money to my name. You get paid bi-weekly, I had not had my first check. And so I started looking up how much the skin cost. Maybe I could just replace the skin and not the mannequin. This is not even the price of an actual skin. This is from the Laerdal website, but as you see, the prices just go up as the size of the piece goes up. And so I really started freaking out. And you're probably wondering how I kept my job. And so I'm going to talk to you about why blue pigment is your enemy and how you can find ways to work around that with moulage. And thankfully Tom did let me keep my job, and he was very understanding because has anyone had stains happen to them? Oh yeah, I felt your pain. I was so scared, but it all works out. And believe it or not, I did a talk on this last year in San Diego. I don't know if anybody attended, but this actually happened after my talk. And so if you use blue, even though I'm asking you not to, think back to yourself, reflect. Ask yourself why you didn't listen to Lily when she was up there all that time. Think back to my slides and how I was crying in the control room. But in all seriousness, it might not be too late. We learned through trial and error, again, controlled. I learned kind of via survival tactics how to get these things off. That you can soak these areas in 70% isopropyl alcohol. And 70% is kind of the marker I learned from the different companies that would come, like Laerdal reps, Lamar reps. It's kind of where you stop to not strip the mannequin. And then you can also check pigment bases. So for example, if you have like a purple paint, does anyone know what colors make purple? Blue and red, yeah. So you might have blue left over. Just check what colors you're using, check what they're made out of. And then I was a chemistry major. Like dissolves like, if there's one thing you take away from this, you can look at what you're using, and if it's oil-based, try to find something like a gentle oil cleanser that can help you. If you're not, we'll talk some more about skin prep wipes, oil-based makeups, avoiding anything really that will strip or scratch your simulator. I went to town on the one I stained with like a sponge and Goo Gone and everything you could think of, and the skin looks a little different in that area of the abdomen than it did when I started. And so, if I can leave you with one tip is buy these. Skin prep, skin prep, skin prep. I swear they should sponsor me and my journey at medical school, but they don't want to pay my tuition. That's fine. But seriously, if you can take this away, take a picture, do whatever. Skin prep wipes are amazing. They're actually built to keep tape from adhering to your skin. but the oily residues in them actually like break up the shadows and the paints really nicely, and then if you just follow up with like an alcohol wipe, you'll be good. And then we do simulator bath time, that's why I have the pictures of the Dawn soap and the alcohol. It's usually a little bit of warm water, some dish soap, which we all know, like the ducks and the oil and the commercials. Yeah, it works. And so if you use that, follow up with a little bit of alcohol, let it dry, usually you can get it out to a certain extent where like it doesn't look like you might lose your teeth. And so, tricks of the trade, something I learned is eyeshadow is your friend. Also take that away. You can also use face paints. I mentioned that if they're water-based, it's a lot easier to use them because everyone has access to water and they usually come right off. It's like when you're working with little kids and everything says like washable, comes off with water. Same idea, still avoid the blue. And then cream contour is always the answer. These are examples of cream contour palettes that we use. If anyone in here uses makeup like day to day, you know what a cream contour is. And I'll talk a little bit about why we like those palettes so much, and then color theory. So use color theory to your advantage. A big reason I mention this is, do any of you guys have multiple like skin tones for your mannequins? Have you seen how hard it is on the darker skin tones to get the same effect? That's why I mentioned color theory. It is really important for your learners to get a diverse idea of what these conditions look like, and I have plenty of examples of how we do it. And color theory seems really simple, but you might not think about it when you say, hey, I'm about to put makeup on this mannequin. And they help you minimize the amount of cleanup, create dimension, and then maximize the amount that you get out of each product. If you know how to mix the colors, you don't have to buy every color under the sun, every skin shade under the sun. You can really work your way up, and once you start building your kit, then you can get there. And so, color theory and use. Does anybody know what condition this might be? Just curious. It's okay.
Psoriasis?
Close. There is some skin modeling. It's actually meningitis, and I'll talk about the case we do with it. It's like a purpura rash. And so I say to be mindful with the simulator skin tone, like we just mentioned. It can look really different. Know how to layer multiple colors so that you achieve lifelike effects. Nobody has like a cut that just looks like a red line going down their arm, you know? And then pick a base that can be easily seen. Again, take into consideration the colors you're working with. And then look up descriptions of the condition. There's nothing wrong with that. When I started, I had no idea what purpura even was. I would hear like rumors, little things, and I was like, how do I even make that happen? Just look it up. There's no shame in that. And then here's the need for multiple reference photos. This is the same condition on different skin tones. It looks completely different. So if I followed one reference photo for one mannequin, I might follow a different one for a different mannequin. And throughout, you'll also see I tried to add clinical significance to this stuff so that you can really justify to your directors, to your facilitators, why you need these supplies and why you're using these techniques. And so yeah, they can look different across various skin tones. And what to look for in reference photos, think of yourself almost as like a dermatologist looking for something wrong with someone's skin. They're gonna look for color descriptors, texture, shape, placement on the skin, and then that's a real photo. I have it in my purse. It's $2.99 from Office Depot. It's a little wheel that tells you how to get like different colors by mixing. If anyone's interested, I thought it was cool. And so don't buy it just because it's cheap. Never, ever, ever use acrylic paint. I had an art teacher in 6th grade, Miss Beverage Like a Beverage, who always used to say, if you want to ruin something, put acrylic paint on it. It won't come off your mannequin. It's kind of the same idea as grease paint. And always check what types of materials you're buying. Like I said, sometimes packaging looks like it's made for children. You might put something on a mannequin, next thing you know, it's acrylic paint, it's ceramic paint. You don't know what you used and you ruin the mannequin. And then just spot test. That's the easiest way. You can do it on like the inside of their palm, usually not an area people are looking at, between their toes, again, not an area they're looking at. And it just helps you spot test, and if you do stain it, it's not that big of a deal. So this is meningitis, and the clinical significance is, once you see this rash, you're pretty much bordering morbidity, so you don't want to be there. And it probably is important that the learners know what that looks like, so if it comes into their emergency room, into their unit, whatever, they're ready. And so this is what we use. Feel free to take pictures again, I really don't mind. I used a Wet n Wild $1 lipstick to draw the lace-like pattern that you see on that arm. And then that was the blood pooling. That was mentioned in the reference photo, and that's mentioned in the condition descriptors when you Google it. And then I used purple shadows for the blue-red effect. I didn't use blue. Purple shadows are usually safe. I know we said red and blue makes purple. They're usually okay, but if you're really anxious about it, just spot test it. And then red and black shadows to mute the lipstick. Usually lipstick has like a sheen, unless you find a really matte one, but you can use it to mute it. Mix what you have and really trial yourself to find what makes it look the most like skin. Sometimes you can even put it on your skin, see what it looks like, and then compare it once you put it on a mannequin. These are all human safe, obviously. And so this was the descriptor of the meningitis rash. It said it usually starts as a small pinprick, it spreads quickly, and it turns into red and purple blotches. And that case was really important to us because Dr. Maldonado, who runs our PGY residence for the emergency room, used to just put up a picture above the mannequin and call it a day. And so when we started showing him, like, hey, wait, like, why don't we just do it on the actual mannequin? He was a little bit hesitant, and then when we showed him, he became a champion for simulation. And so, small dense brush, all it takes, probably $1 in the e.l.f. section at the makeup store, Target, Walmart, wherever. And then the eyeshadows were actually donated by one of our coworkers, Jen. They worked amazing. I did the deep purple as like the base of the pinprick, and then to create dimension, just a little bit of the light color in the middle. And that was the gunmetal effect that his case was calling for. And so we called it one palette, endless options. Those are a lot of shadows, a lot of different tones. And if you are not familiar with makeup, those are some brands that are known for being like high pigment. They're still good quality, but they're cheap. They're like $5 to $20. And just make sure that the palette is predominantly matte. A lot of these palettes have glitters and stuff like that, which is not as realistic. Although sometimes like the sheens do make it look more human-like because we're warm-blooded and we have color to us all the time. And then the most four versatile shadows that we found were deep browns, blacks, and reds, and then ivory to kind of dull them down. And that works great for any type of bruising. So like you see, we did car seat straps after a car accident. That's all just shadow. I just took a brush, laid it on the baby, had great results when the NICU, when the PEDS people came in to treat the baby. And so, cream contour will get you a long way. I said it was really important at the beginning of the talk. It comes in a variety of skin tones, like I've harped on many times already, and it can be used as a base layer for shadows too. It helps them clean. And you want to find products that do that because obviously when you're treating someone, if you grab their arm that's bruised, the bruise shouldn't come off on your hand. It might sometimes still, but we do the best we can not to do that. And then it can be set with skin powder if you're trying to avoid that, or if it's too shiny on the plastic, like I don't know if you guys are familiar with like Gamard legs, how they're plastic, but the body is like the silicone rubber. Yeah. So if you put skin powder on it, it can kind of ease that. And then it helps you create dimension, and the consistency allows for easy removal. And this is a car accident we did. The cheeks and bruising are all cream contour, and then some shadow on the sides. And I'll get to what the nose is in a second. And so these are the reference photos, and this is all we used. Those aren't the exact tattoos because they were on the mannequin by the time I was making this presentation. But this is the cream contour palette we use. Play with the colors, see what creates the hollows, the bruising effect, the dimension. A lot of times I use my fingers with these, or just like a beauty blender, which is a makeup sponge. And then these skills are transferable. Are any of you in sim centers that have SPs too? Okay, so are we, and we didn't work with the SPs a ton as clinical sim ops specialists, but they were there, and one day, Stacy and I and Jen got a text from our friends Jody and Jordan, and they were like, hey, you guys do really cool makeup. Jody was in charge of ATLS, the trauma course for adults, and so she had seen some of the moulage I had done for her. And when she said that, I was like, all right, let's see how we can do it on actual humans. I've never actually done it. Turns out, it worked out pretty well, and we went to a local high school that was doing a drunk driving incident, and she was like, it's gonna be filmed, it's gonna be awesome. I'm like, I really believe you guys can make it real. And I was like, oh my God, we're going to Hollywood. I don't have to go to medical school anymore. This is awesome. And it wasn't quite Hollywood, but they did publish it in the Alachua Sheriff's Office Instagram. And then this is actually a little video. Of just a time lapse of us doing the makeup. And that's exactly what it looks like when I do it on the simulators. It's really like a one-to-one mirror, and it was really fun. And the kids were so excited about this that they actually asked for permission from their teachers, from their principal, to wear this back to class, which was a little bit daunting. But the more wholesome part for me and what was really exciting is they actually were asking us like crazy if they could volunteer at our sim center. There's your buy-in. It was amazing, and I was like, yes, volunteer. Do you have a license? I don't know how old you are. This is awesome. I was just as excited when I started. And the clinical significance is so many people died from DUIs and things like that. This is a way to make those scenarios realistic and really drive home what you're doing has meaning. Okay, and honorable mention to Stacy. She actually did these wounds. I think Rose is in the back. She helped her too. They just get more realistic the more you practice, right? My wounds definitely did not look like that when I started, but we're really proud of how far they've come. And we use the same techniques, the same scar wax, same fresh scab to make them on these mannequins that we did to make them on the SPs. And this is what was used. We used temporary tattoos. They're literally your best friend. They're so cheap on Amazon. Just look up like Halloween trauma tattoos. Throw out the weird vampire bite ones. You're good to go. And actually, if you have like a kid gets bit in daycare scenario, keep them. And you can use liquid adhesive. Again, spot test with that stuff. It's probably better for the SPs. Or if you lay down like Tegaderm or things like that, then you can use liquid adhesive. Makeup brushes, you see them in there. It's the same cheap ones. Gel scab, I have the brand on a couple slides down. And then contour palettes and blood concentrate. They come with all your mannequins that have like additional pieces. You don't have to use it like blood concentrate, just use it however you want. That's what we did. We drenched gauze and then we filled little pockets and things like that. And here's some wrinkles we did. And all we did for that was literally cream contour, creating dimension. And we mainly started doing that because you'd be surprised how many learners actually start to get so into the simulation and then you're like, this is your 85-year-old male patient. And they're like, wow, Mr. Hank, you look awesome for 85. And so we were like, how's the way to get around this? So we started doing the wrinkles, we add a gray wig. We do little different things that just keep them immersed in that little world that you created for them before they came in. And this is, again, another one where we're just creating a little bit more realism. We did, or I shouldn't say we, this is Stacy. She did pallor on this mannequin, just added some eye bags, added the wrinkles, gave him some life, or took some away. And then here's the cheap brushes I'm talking about. These I actually don't know where Tom found, but I'm sure if you go to any craft store, or honestly even if you just cut up like a dish soap sponge, you can create those same effects. That one is just a makeup sponge, the egg-looking one, and then these are all just a variety of brushes. And even though I'm not a field researcher, I did do some for y'all. And this is what I found. Literally when I was picking up some prints at Office Depot, between $2.99, $3.99, the max is $12. It's really not bad. Buy the little trays if they make your life easier. I actually found paint sticks I had never seen before, but they'd probably be great for bruising quickly. And yeah, the brushes are cheap, but like I said, don't buy it just because it's cheap. Be careful of what you're buying, but brushes are usually safe. And then I want to remind you to play with textures. This is a newborn baby. They're usually not a clean mannequin when they come out of their mother. And so we wanted a way to emulate that, and this is what we found. We had baby powder, Vaseline, crushed shadows, gauze, mineral oil, and what we did is we just started playing around with them until we got an effect we needed. And you wouldn't believe how residents react when they're holding a wet baby instead of like a silicone-y plastic mannequin. I honestly started thinking during the axolotl presentation, I was like, maybe I can do something with this. They probably feel about the same, if anybody was at the planetary in the morning. And here's some pictures of literally what we use. It's very straightforward. The dollar store has them. $1.25, you have a gooey baby. Oh, and the reason I put both Vaselines is this is more like gloppy if you want to do like burn blisters, things like that. The cream one is like cover the baby, it's easy, it's not as like messy for you. And then firework explosion. Hats off to Stacy. When she sent me this, I was like, forget this, I'm going back to my job. That looks so cool. And I'll show you a little bit about what she did, but obviously 4th of July, Florida man does his own fireworks. His kid pays the consequences. And so this is what she used. They had tissues to lay down a base and really form that like skin raised effect. And then they used school glue, which is also washable, and we all have like done the snake skin thing where it just peels right off. It peels right off. And so you also have contour palettes once that's dry that you can use to make it match the skin. So here you see it matches the skin pretty good. And then for the blood, the scabbing, we use Special Effects Scab, which Ben Nye, if you guys are familiar with that brand, they have a good one. It's called Fresh Scab. Or Bloody Mary. I had never seen that before. I actually zoomed in to Stacy's picture. I was like, whoa, this is new. But I put it on there because obviously it gave them a great result. And then you can also put smoke dust around their nostrils or just use eyeshadow. It's the same. Crush up some gray or black eyeshadow and it'll work just fine.
Can I say one thing?
Yeah.
What I wanted to do too with my accent when it comes to a burn on the eye is that I want to somehow get a silicone to place over the eye. So I don't want to get alcohol when this goes down into the mannequin because I don't want to get fired. But my next step is going to be to figure out how to get something silicone to place over the eye so that way if the eyes aren't moving or anything like that, then I can still have this one covered in blood and all of the fun products that we get to use. So that is something that I want to take to the next step for the next burn situation. So that too, like I just wanted you to realize, I wasn't able to burn the eyelid on this one. But
Yeah, you did a horrible job, Stacey.
I know, but the next one I go to sheet
I use Tegaderm.
Tegaderm
Yeah.
to like
Yeah,
place
it just
over.
creates a barrier.
Yeah, so that way it won't get in the mannequin. It was a fast situation, so I like.
And it still turned out awesome, in my opinion. I think it looks so good. And then the next one we have is meconium aspiration. This is kind of a gross one, but babies that come out and are at risk for meconium aspiration are covered in feces and fluids from their mother. It's actually really dangerous. I put the stat there to just drive home why we care about realism so much at our center. And the NICU and the PEDS residents loved this. When they walked in, they couldn't believe we actually had meconium waiting for them. And it was so fun to see the reaction from the control room every time. I was like, look, he's freaking out. And there was one resident that stopped at the door. She was like, is it gonna smell? I can't do this right now. I was like, no, but you can make it smell. Somebody gave us like a deer attractant spray or like liquid blank that I can't say because I'm being recorded. No, but you can use those things if you really want to amp it up. And then here's what we use for that. 3 products, super simple. Mineral oil, cover your baby in it. Be a little bit careful if you're using the Gomorrah babies is the only note I'll make. For this time around, we left the pads because once they dried her, they were gonna shock her. But if you guys flip her, she has like little prongs that go on her back. Be careful not to get the mineral oil and the paints like super in there. As much as we're pushing realism, we're also pushing job security. So you want to make sure your simulator still works during and after this. So just be a little bit weary with the mechanics, but we didn't have any problems. And so we used mineral oil, doused the baby, it gave him a wet appearance throughout the entirety of the case. I broke some black shadows, and like I said, you can use the end of a makeup brush and scoop it out. They also sell loose powder shadows if there's colors that you're like, I need this loose all the time. Just buy the loose one, it's probably like $1 more expensive. And then we used brown washable kids paint, and what I did is I just took a super small amount on a paintbrush, poured some mineral oil in a cup and mixed that, and then rubbed that on the baby. And that's what gave it like the splotchy, wet effect and made it bubble up kind of like fluids do when they're on you. And it's not a ton of paint, and it comes right off of water. And then this was a bush hog accident. And what we did is we used our simulator to our advantage. Most of these have a piece of their leg that comes out for femur fractures or IOs. We just pulled it out, filled it with gauze, drenched it in that blood concentrate I was mentioning, and then grass is free. Valeria took some grass from outside, we put it on the wounds, and this was so realistic in the moment that one of our EM fellows, the PEM fellows, couldn't find a tourniquet, and he had military background. He was so into it, he jumped on the table, pressed his knee on our tiny simulator, and goes, somebody run to my backpack and get the tourniquet now. Aww. As you can see, he likes doing simulation, and he would come back with his learners when he's a facilitator one day. And then this is all that was used. The gauze I mentioned, fake dirt. You can also use brown eyeshadow. Concentrate, not pictured as the grass. And then ask for donations. I didn't know gauze expired until I started working here. You don't think about those things. The hospital just throws them away. Gauze expires, Q-tips expire, everything expires. So, and most people honestly don't want to walk it to the dumpster. If you go to a unit and say, hey, can I have this bag of expired stuff? They'll be like, yes, please, take it off my hands. I don't want it. You walk it to the dumpster. That's fine. You walk it to your sim center. You have a great Bouchard trauma now. And these pictures are some we're also proud of. This bottom picture is kind of how the burn started, and then we started to tweak it to the pictures on this side, which look a lot more realistic, a lot more like crisp skin. And then those are actually Stacy's hands. This was a big one for us. We were doing with our EMS friend Jordan. And like you can see the moulage kit in the bottom, we were trialing and erroring. And we used Tegaderm, we used cling wrap, mainly so that because you have to handle the burns, you can do that, put it over what you just did, and it keeps them from transferring. And for burns, it's helpful because they blister, so it doesn't really matter that there's like saran wrap or cling wrap. It actually makes it a little bit more realistic. And this is what was used. The Tegaderm for texture on the skin, foundation. We had like a matte beauty primer from Wet n Wild. I think it was like $3 or $4. That was just to keep some of the skin from looking so plasticky. If you rub it on the plastic, it's basically a matte sheen and it's transparent. And then the bottom is face paints. Again, be careful with the blues, but you can use them, especially if they're water-based. And then we just blended the edges of foundation and Vaseline and globs, like created the blisters. And then some keys to using face paint. I've already mentioned all of them. Spot tests, minimal water, you don't want to drown your mannequin. And then avoid pigments. And then this last little section is about how molds can give your task trainer a new life. They're cheap to make. They can be used more than once, and they allow you to manipulate the mannequin's condition. And so this was another really meaningful case we did. This was actually gonna be a birth coming into UF and Shands, and the baby had a plethora of conditions that they were gonna be born with. It was gonna be an emergency C-section. They were scheduling the mom. It was all of these things, and they said, hey, can you help? Like, our learners need to practice this, or not learners, really practitioners need to practice this before this baby is brought into the world. So we molded a cleft palate. Jen and I literally went to Michael's, got some supplies, and if it plays. This is actual live footage of the ENT residents practicing how they were going to suture the ET tube into the cleft palate. And I can't tell you how many times they thanked us for actually making the cleft palate, giving them a way to say, I don't know if you could hear the one resident who was like, how am I going to secure this tube? Like the cleft palate's in the way. And you hear the other one go, let's suture it to the cheek. So they were thinking through these things before having to do it in real time. And obviously you can see some of the pictures. It looked pretty cool. And obviously clinical importance was that difficult intubation. And we actually did put this baby in Victoria so that they could use the C-section belly and everything held up. We use liquid adhesive, and then I'll show you what we use to make the actual cleft lip. And then the other condition this baby had, before I show you guys what we used, is they had an unfused spine, and so they couldn't work with the baby on its back. And one of the residents that was in there, and the physician overseeing him, grabbed the baby, flipped it, and then we're like, holy blank, I didn't know this was gonna be here. And so they were trying to process through that and work through that, and we got a lot of kudos for doing that for them too. And this was just a retired sim baby we had. It didn't have any soft or anything like that. It was just laying in the corner of our high density area. And then these are the molds Jen and I made. We painted them with the same washable kid paint you guys saw. And then we just used some shadows and things like that. Obviously, it's still not extremely realistic because we're working around zippers and things like that, but we did the best we could and got really good results. And then we just used Michael's air dry clay for this. It's really cheap. I think it was like $10 and you can make any shape you want. And then all we did is we put those molds on wax paper, let them dry, and then transferred them to a metal tray and poured silk pig on them. And there you see our little arts and craft table. We were there for a really long time that day. We got it figured out, and you can see the different iterations of the molds there too. And then here's the silk pig if you want to take a picture. This is really easy. It's a one-to-one mix. It comes with instructions. You can buy big buckets, small buckets, and we use them to make abscesses for incision and drainage. We use them to do things like molds. We use them to make the tiny little cleft palate. And then we also use them in this scenario. I called it no skin, no problem because does anyone know what mannequin that is? 3G, layered off. You usually don't use him for chest tubes. He has a little slot for it, but the tube doesn't go very far. And we needed, I think, 5 chest tube task trainers that day. We only have 2 trauma men. I don't know any sim centers that have 8 different trauma men laying around waiting to be tubed. So all we did is we pulled out the insert in his chest tube cavity, covered it with a sheet we made of Silk Pig. We literally just poured the mixture on a tray really thin, let it dry, came back, placed them over, and the best part was you could just scoot it and go to the next person, scoot it and go to the next person. So we did this with 2 layer dolls. You can also do it if you run out of trauma man skins, like on a click, like we just need to get this done today. And all you needed was Silk Pig in a metal tray. And then lastly, one of my favorites because it looks funny in the control room, tongue edema. You can just use silicone to mold the shape of the tongue. And then you can also use a 3D printer. I actually put this in here because Stacy and Luis are working on a way to do that. Use a 3D printer to make different things you can incorporate during your moulage. I haven't personally done it. This tongue actually was like somebody poured, I think it was silicone or Silk Pig, mixed it, made this like hard ball, and then kind of like cut it to look like a tongue. And you just shove it in the mouth, works great. Talk gargled in the control room. Now you have tongue edema. And that was really fun too. And my biggest thing is that the more you practice, the better you'll get. We all carry around lanyards that say play like you practice. I really believe that. It's not practice like you play, it's play like you practice. When people practice in realistic scenarios, they play like how they did at the sim. We've had people call and say, hey, you guys just did a seizure in situ. We had 3 seizures today. Hey, you guys really helped us when we could do this C-section and stitch this ET tube to your baby's face. Now in real time, we're confident. We know our game plan. If things change, at least we have a place to pivot from. And where we started was literally that mask that one of our interns, Jenna, is holding up. We used to just slap that on a mannequin, any trauma. Doesn't matter what the trauma was. Bicycle accident, train accident, fight at the UFD. It was the same face. Not the best skin tone because it doesn't actually match any of the simulators. But now we've moved on and I am so proud of where we are. And here's my references for the clinical significance and any questions. You can ask, please. Oh, feel free to comment. I'll take it. Thank you. No, really, if you have any questions, yes, in the back. Go
Do
ahead.
you use anything, do you put anything over the makeup once you get it in place and ready to go before the simulations begin so that it doesn't rub off?
So usually what we do, if learners see things like cuts or bruises, they're usually not going to touch them because on a real patient you would try to avoid grabbing them and things like that too. Plays into the realism, but if you are worried about it, Tegaderm is probably your best friend. It goes really easy on the mannequins. The tattoos don't come off, so if you're worried about things coming off, I would say use the temporary tattoos. They don't come off on hands or anything like that. And when you go to clean them up, just wet it a little and it literally rolls right off the silicone. And if it doesn't, little alcohol pad comes right off. Other than that, like I showed, the cling wrap is usually a good option, especially if you don't have a lot of Tegaderm laying around. And the shadows and things like that actually don't come off as easy as you think they would. They smudge before they come off. So maybe the bruise will grow a little, but it'll still stay on the mannequin for the entire sim. And like you guys saw, with the cleft palate baby, we used washable paints and things. They're dry, and they didn't come off for the entirety of the practicing. It came off maybe a little bit, but the color was still there for the entirety of the procedure, so no need to cover everything. If you find that something's smeared a lot, throw some Tegaderm on.
It is something that I'm going to look into a little bit more because I have had a couple of different scenarios where I will have a gash and then the emergency medicine professionals will want to cover it. And then I'm going to have to do the sim over and over again. So instead of me just going back, putting on the modeling clay and the blood and everything else to make it look realistic all over again, I'm going to try to, I'm going to try to figure out something that I can create and then reutilize, but still make it realistic. I don't want anything that's gonna be pre-made and that looks fake. I wanna make it as realistic as possible. Yes.
Yes, and if you look at that, there's a lot of them are really nice, silicone, you can still go back and contour color them.
Right.
And I'll tell you the biggest downfall of them is just keeping track of the
Right.
yeah. Because there goes your $200. Yeah. Yeah. And really quick before you ask your question, another workaround, Jean and I did a big thing with anesthesia, and they had some post-surgical incisions, and they did have to uncover them. So what we did is I got a bigger piece of gauze in the incision and like bubbled it, and then taped it down so it wasn't actually touching the incision and they could still peel it. Worked great. I think we did 3 rounds in like 2 hours. The incision didn't move, didn't smudge. It was totally fine. If that makes sense. Basically just create like a cup above it and tape it down. Go ahead.
About your point, we did a big MCI this past year where we had a shooting, and so we pre-made a lot of bullet wounds, entry and exit, and then different skin colors, and so we had them on, entry was up here, exit down here, and then maybe a couple days before we started putting them on our mannequins, and then the day of we put them on our SPs, and tried to put a little blood here and there. But that made it so much easier than trying to
Do it all.
Create it every
Yeah.
second.
Yeah.
I had a question though about your that first face mask. I never would have thought of leaving something moulaged.
This one?
Yeah.
Yeah.
Will it come off if you leave it on for a long time?
Okay, yeah. So one thing about any moulage, when I first started, there was signs all over the swim center that said like, do not leave grease paint for more than like an hour. It was like you had a ticking time bomb because it's probably gonna stain something or not come off. For the eyeshadows, the cream contours, things that go on human skin, you're usually pretty safe, but I would say at our center, we usually just do cleanup right after the course is done. I will say there's ATLS, which is a 2-day course, and PGY, which is a 2-day course, which is what we do the meningitis for. We leave it overnight, and it's totally fine. It's a 2-day event. I wouldn't go pushing your boundaries and leave it for like days or weeks at a time, unless you have a retired mannequin whose sole purpose is to be moulaged. Like, we have a recess Annie whose sole purpose was ECMO. She had some bruising and things like that. She lived like that, but we didn't use her for anything else.
I mean,
Other than that, I would say like 30
too,
minutes.
is when you do make inside your mannequins, and then you place the chest skins or whatever skins you have, keep the.
Yeah, we
skins
keep all the
fresh.
skins. But I would say you're usually safe an hour, 2 hours, 2 days. I just wouldn't push it past like 3 days. That's kind of like when you want to maybe just redo it. It's not worth not taking the extra 30 minutes or an hour to do the makeup. Just redo it and save your mannequin. Any other? Oh, yeah.
Have you worked with the new Cement 3G?
We have, yeah.
Have you noticed that normal tachoderms?
Yes, and actually, I'm so sorry it's not in here. And it's not the best solution, but you can put makeup over it to make it look more like flesh. There's a blue tape they sell at the hospital. I can pull up a picture of it. Our coworker Jean, who is from a nursing background, was actually the one who thought of it. It sticks. I don't know what they make the tape out of, but it works. Also, how I mentioned skin prep is supposed to be for the adhesive not to like stick to your skin and like melt like it did on the old 3Gs. If you wipe a little bit of the skin prep on the area you're gonna tape down, it can make it a little bit easier too. I don't know if you guys have found anything since I left to help with that.
We like to use like the clear rolly gel glue sticks if something's having
Like school glue.
yeah, like if we're having trouble, and also in lieu of Tegaderm we use a lot of saran wrap to cover bigger pieces, right? So that will stick to itself or almost anything. So
Yeah, we're actually, it's funny you mentioned that because when I presented in San Diego, one of the people in the back was like laughing the whole time I was talking about crying in the control room. I was like, that's kind of morbid. You're kind of mean. He was a Laerdal rep, and he actually came up and was asking about the slides and how they can make it better. And the reason for the tape not sticking, so they say, is that it's supposed to be skin that stains less easily. It now has the problem of not sticking as easily, but you can find little workarounds. And the blue tape I'm talking about is like a baby blue. It's like a whitish blue color, so it's not that hard to put cream contour and make it look like a skin tone.
Sorry,
It's silicone tape? Yeah. Sorry, I don't know the name off the top of my head, I just have the picture. Go ahead.
Sorry, so So, like, we complained because we got 6 of them.
Oh my gosh.
So they-
Congratulations.
They sent us, a kit. I honestly, I don't know what it is, but what they had in their kit, all of it was,
Oh, awesome.
super expensive. It's like a
And-
nursing triage kit.
Is it expensive, you said?
We got it for free.
With the mannequin, right?
I mean,
It's
if
kind of
they
like how you
sell
get a
it.
keychain when you do art. Yeah, well, if that works, that's awesome. I don't know, you guys, I still have like 20 minutes, so feel free to keep asking questions, or if you have to go, that's totally fine. Okay.
So there's a question about the tattoos. So we put on, ID taker and it comes with a hot and so the date on it. So we have a mistake. So put the ID on and the same as what it is. So we don't use the fake ones because we're afraid that they're gonna.
There wasn't
We
much
haven't
before
had
the
that,
presentation.
I was gonna say, we haven't had
did you
that
get
help,
your
so it's like the date on the
It's
actual
like-
Yeah,
tattoo.
it's well, you know, your date on the taker.
Oh,
On the
I
ID taker, so you can see put an ID and it leaches through on our.
Okay, I haven't seen that before. I guess maybe the ID ones we had were probably older because they were donated as didn't have dates. I would say, see if you can take alcohol, before you put it on the mannequin, see if you can take alcohol or a little bit of acetone to the date. Usually acetone lixides like right away. It'll probably eat away from the things, but just like dab it with a Q-tip. See if it takes the date off and then let it dry completely till there's no acetone or anything like that.
Okay, thank you so much.
Yeah, here, let me see if I can pull it up. And then any other questions while I'm looking at? Yes. I don't know if anyone heard that, but he said fix is what the product is called. Yeah, that's a great one too. I haven't heard of that. Thank you. Yeah, that's two really good ones. We're always looking for ways to make things stick.
What was the second one? I'm sorry.
Yeah. So the tape is from the Nexicare brand, and it's sensitive skin. Dental paper first tape. And if anyone wants to come look at the picture from Stacy, she's got it. Look up. Yeah. And they have it at CVS, is literally the website she's on. It's like $12. Amazon's probably cheaper.
They do sell that on Amazon.
Yeah,
Like,
Amazon.
rolls at a time.
No, you can find it on Amazon. Any other questions, comments? Our contact info is up here. If you want the slides, I sent them out to people last year. Feel free to email me. There is an extra N after the A. It's on purpose. My middle name's Nicole. Our Instagram, that's my phone number. I don't care if you text me. I'll probably see it before I see the email. And then STEM Specialist is my team that is still over at the University of Florida. And thank you so much for coming. It was such an honor to talk to you guys. And shameless plug, I'm doing a Sim Survival Guide at 2. I actually have like a physical book that we're going to be showing, so it's really cool. If you want to come, it's a hot topic. I won't talk to you for another 2 hours, I promise. Thank you so much, you guys.